And this is the perfect segue to talk about patient concerns and questions. So patients not wanting to look pulled or overdone. And I think one of the main reasons why we're able to have such natural results is that we're working with the deep tissues instead of just the superficial layer of skin to prevent that unnatural look.
And then we already mentioned the importance of a more vertical angle of lifting, because that's really what gives you the natural look, counteracting the vertical downward pull of gravity, avoiding that swept back or wind tunnel look that is a giveaway that someone had a facelift. And so when we talk about newer facelifts, I know from my own experience over many years that the technique, it changes. It's we're always looking for how to do things better, and there are a lot of great facelift surgeons, and it's not necessarily one surgeon's technique. We can borrow from multiple techniques, pick the best of each one, and that's one thing that I have done over the years.
The other big question that people have is how long will my facelift last? I think that's kind of a question where people have gotten used to the fillers and needing multiple injections or Botox fading and things like that. And I think with these deep plane facelifts, Dr. Langdon can really speak to this because he's been doing these procedures for so long. So he has the follow-up of looking at patients 10, 15, 20 years out after their facelift and seeing how that ages over time. So I'll let him take that away.
Yeah, we do see patients that we haven't seen them for many years, but they don't look their age. So it may have been 15 years ago or more that I actually did a facelift on them. But when I see them, I know right away, this person has had something done, because no one their age would look this good. So a lot of the things that we see improve, they are very long lasting. Gravity is a force that we are always going to be dealing with, but it takes a long time after a lift, to have the sagging recur to the extent that it was. So we always say you should look better, at least 10 years after your surgery than you did before you had it done. You won't look as good as you did maybe a year after, but it takes a very long time for that sagging to recur. Then other parts, when we deal with fat excess, like under the chin, that part of the neck, and in the jowl, fat removal is really permanent. So that someone's neck should look better from the standpoint of less volume, really indefinitely. And then improvement in sun damage, with laser resurfacing. That is the one. Sun damage is the one aging factor that people have the most control over. So if they limit sun exposure and use sunscreen and the right type, the right amount of sunscreen, wearing a hat, when the sun is at its highest, it can also be many years, or probably never, if they're really good at, minimizing sun exposure, they may never, get back to where they were as far as having extensive sun damage.
The best rule of thumb is that patients generally always look about 10 years younger. So we've dialed the clock back about 10 years, but time does continue marching forward. So we unfortunately haven't found a way to prevent that, where you can have someone look 10 years younger and then stay at that age indefinitely. You can do things to help that, like Dr. Langdon was saying, in terms of sun avoidance and sunscreen, and then also maintaining a stable weight and a healthy lifestyle is really part of that, because I think with significant weight gain or significant weight loss, that can really have an impact on how you age moving forward.
So another, frequently asked question is as we talked about before, the healing where the skin incision is made. Is that going to be a scar that is visible? And as we discussed earlier, the incision itself is, placed in a very natural kind of pattern, in front of the ear. And it always has to be in front of the ear. People sometimes say, can I just have an incision behind the ear? Problem with that is the ear itself would be a barrier. You could not access the face, which is where you really have to do your work. So it has to be in front of the ear. But it is, in really just about all cases for us, we are able to use that much shorter incision. And the key to any skin incision is that it not be under too much tension, because it will heal with to the point of being invisible if it is not under too much tension. And I think Dr. Sarhan also talked about, part of it is actually behind the hairline in the sideburn area. So we make a special kind of slanted incision that when it heals, after it heals, the hair follicles will actually grow right through where that incision was. Plus, you've got the hair in that area. So part of the incision is, totally hidden because of the hair growth in that area.
And I think another really important thing to think about also is that, like Dr. Langdon was saying, there are some patients that are going to heal phenomenally well, and other patients will have a little bit more of a propensity to form thicker scars. The thing is that we're able to address those problems when they do come up, where you can use steroid injections to lessen the thickness of the scars. We have access to multiple lasers that can help with the redness. And there are ways to help scars that don't look ideal right away. And so going to someone who has experience in dealing with problems when they do occur is really important. The other thing to mention about it is that there are several other techniques, like the no scar neck lift, and there are other ways to be having facial rejuvenation, not to the same extent as a deep plane facelift, but if you really want to avoid scars altogether completely, the only way is to have a different approach. And there are multiple other approaches, and we talk a lot with our patients during consultation for how to avoid scarring altogether. But those are different, less invasive, but also less dramatic of a result approach.
So another advantage with any skin related issue, even healing, with a background in dermatology, we have really that high level professional expertise to get the best results. And that's true also of the certainly laser resurfacing. We are a major laser center, so we have many devices that are used to optimize the skin appearance. So both to counteract, sun damage, but even other skin problems. And so we have a lot at our disposals as far as technologies that can help us get the optimal results for all of our patients.
Another really big question that comes up a lot is facelift surgery painful? And I think it's really telling that I haven't, in my experience, seen somebody who needs an opiate medication after. We're able to control the pain with equivalents to Tylenol. And so that really says a lot. There is some tightness, obviously, from the lift that happens. So there's a tight feeling, and that relaxes over time. But it's not something where I've seen people reporting pain or having pain after the surgery that is really long lasting. There can be afterwards some loss of sensation, but that is the sensory nerves that regenerate over time, and that sensation comes back.
So another big advantage of local anesthesia is that it is totally effective. So there's no pain whatsoever during the procedure, but also it is long lasting. So the numbness will continue for several hours after the procedure itself. And by then, any pain tends to be a lot less. So we do find the majority of patients simply need Tylenol or just, or even non-prescription over-the-counter pain relievers. But that is in contrast to general anesthesia, where once the general anesthetic effect has worn off, there can often be, much more pain just because there has not been this more profound level of local anesthesia use.
Another big question that we come across a lot is really what is the difference between a good facelift and a bad facelift? So to spell it out, like we've been talking about, the bad facelifts are where you're overly tightened and you look like you're in a wind tunnel, the horizontal swept back look. Sometimes there can be bad positioning of the ear where the earlobe is cropped to make it look really small, and can be called a pixie ear defect. And that's really in contrast to a good facelift, which I'll let Dr. Langdon talk about.
Yeah, so again, the most important thing is the natural look. There's a lot of Hollywood celebrities, that go overboard and do too much and don't even look like themselves. So there have been many examples of actors and actresses. People are shocked. Why do they look so different? And that would be an extreme example of an unnatural look. But I think the number one parameter is that patients look natural. So we frequently hear that confirmation from our patients that no one even knew they had surgery. They just know they look a lot better.
Right.
So that's really what a good facelift. It should result in improved look without anything really obvious from having had a procedure. So the contours, one big one is the neck. If you look at somebody from the side, this saggy look in the middle of the neck, that's what we don't want to see. We want to see a nice lifted angle. That's called a cervical mental angle in the neck, and then just like sagging jowls, we want to see those lifted, restored to their original position, and of course the healing of where the incisions were, minimal if any scarring.